I'm Dr. Michael Streitmann. I'm a board certified plastic surgeon with Westlake Dermatology and Cosmetic Surgery. And today we're going to do a brief webinar about blepharoplasty or eyelid surgery. People often ask me what my favorite surgery is. And I usually say that I don't have a favorite surgery. I have several favorites, but blepharoplasty is definitely one of them. It's an easy surgery to recover from. It's not very painful, and it's something that is affordable, and it makes a big difference in someone's appearance. You might not like the way your abdomen looks or the way the skin might hang under your chin, but people are looking you in the eye. That's the first place they make contact with you. So you kind of get the most bang for your buck from blepharoplasty surgery. And we could get the slide to move. There it goes. We'll talk about the upper eyelid first. Upper eyelid surgery can be done under local or general anesthesia. If it's done by itself, most often it's done under local anesthesia in our office operating room. The incision is unseen with the eyes open. So if you close your eyes and keep them closed, you can see the scar. Otherwise, it's briefly visible during a blink. The sutures in the upper eyelid are dissolvable, so there's nothing to remove. Usually during the surgery, excess skin is removed along with excess fat and some of the muscle that closes the eyelid, which kind of debulks the eyelid, makes it look thinner. If all goes well, which it usually does, you can be back to full activities in 2 weeks, anything you want to do. It is also the most common surgery done cosmetically in men. As the population gets older, upper lid blepharoplasty has displaced liposuction as the most popular procedure for men. If you have any questions along the way, I think there's a little question box. You can start filling those out. We can answer those at the end. So here's a gentleman in his early 50s who's had upper eyelid surgery. You can see where I'm pointing here, where the skin is actually almost covering his upper eyelashes on both sides. And then this picture here is about a month after surgery. You can actually see the edge of his eyelid again. And here's a side view. You can see the hooding over the side, almost like a blinder. And then here in the after, you can actually see his eyelid showing there. Here's a female picture. She's early 40s. Once again, in the before picture, you can see the skin literally resting on her eyelashes, although you can still see her eyelashes. And the gentleman before, you couldn't even see the eyelashes. And then this is the after picture. Believe it or not, this picture is only 2 weeks after surgery. This is not a typical result to have a postoperative appearance like this at 2 weeks. There's still usually a little swelling, might be a little bruising, but her stitches have all fallen out and she just had an incredible recovery. Probably the best recovery ever. Here's a lady who's a little older. She's actually in her late 60s. You can see the excess skin of the upper eyelid on this side kind of resting behind her lash line. She's actually had a blepharoplasty in the past. So this is a revision surgery. And here's about 3 weeks after her surgery. You can see there's still a little bit of redness of the upper eyelid, but much more of the upper eyelid is seen rather than being covered by the excess skin. So talk about lower eyelid surgery. It can technically be done under local or general anesthesia. I almost always do mine under general anesthesia because I like to make the incision inside the eyelid where it is not visible rather than outside of the eyelid where it can be visible. So the eyelid incision inside is completely and totally hidden. We put in protective plastic shields over the eyeball during the surgery, so there is no chance that the eyeball can be hurt during the surgery. Those are put in after the patient is put asleep and then are taken out before they wake up, so you have no recollection that they were ever there. But your eyeball is at no risk whatsoever during the surgery because it's completely protected. The cut inside the eyelid requires no sutures. It heals in about 24 hours. The main objective of lower eyelid surgery is to remove the bulging fat pockets of the lower eyelid. And once again, you can be back to full activities in 2 weeks. This is a younger patient. She's actually only 20 years old. In some people, the bulging of the lower eyelid can become pronounced in your middle teenage years. Matter of fact, my eyelid started bulging when I was in high school. And here's her after photo on the right. Once again, the scar would be here in this region if there was an external scar, but in her case, there is no external scar whatsoever. And had a little technical difficulty again. Here is the frontal view. You can see the swelling of her lower eyelid, the fat bulging, and it's actually red in color from the bulginess. And then this is after here. Vastly improved redness, vastly improved bulge of the lower eyelids. And once again, like I said, she's 20 years old. Here's an older patient. All she wanted was her lower eyelids done. She didn't want anything done with her upper eyelids. Here in this side view, you can see the bulging of the fat of the lower eyelid. And then in the postoperative view, that has been removed. And here's the frontal view. There's the bulging there of the lower eyelid. And then afterwards, you can see there's a nice little depression there on either side. Once again, lower eyelid surgery and upper eyelid surgery, actually. You can see the extra skin of the upper eyelid, the bulging of the lower eyelid. And this is the after photograph here. This lady is in her mid-30s. Another younger person, mid-30s, bulging of the lower eyelid, heaviness of the upper eyelid. And then after, you can see how much more of her eyelid is showing here rather than having the skin resting on it. And the contour of the lower eyelid is more concave rather than being convex. And when you're talking about eyelids, sometimes you have to talk about the brow. Oftentimes, excess upper eyelid skin is related not only to laxity of the upper eyelid, but due to the brows starting to fall. And when the brow falls, you get even more extra skin of the upper eyelid. So a brow lift can be performed under local or general anesthesia. It's often needed in older patients, not often needed in younger patients. Incisions are made at the hairline or a little bit behind the hairline to remove the extra skin and to lift the eyebrow. So the scar is at or behind the hairline. Sutures are usually removed after 7 to 10 days. And once again, you could be back to full activities at 2 weeks. So one caveat that you need to know is if you do have a droopy brow and you do your upper eyelids only without repairing the brow, without lifting it, you can actually pull your brow down further. So like I said, not an issue for younger patients, but can be an issue for older patients. So this is a case here that was a brow lift only. There was no upper eyelid surgery. There was no lower eyelid surgery. She's in her mid-30s. And you can see that she has all this extra skin resting on her eyelashes. But when you lift her eyebrow up to a natural position, all the extra skin goes away. So here's the after photograph here. So the brows have been lifted, the extra eyelid skin is gone. She didn't need any other surgery. This is a lady in her late 40s. You can see that she has skin resting on her upper eyelids and her brow is low. Matter of fact, the middle part of her brow is much lower than the lateral part of her brow. And this gives an angry appearance. That's her main complaint was, people are asking me if everything's okay. Am I upset? And she wasn't. It was just that her brow had fallen and given her that look. So here, the middle part of the brow is actually higher than the lateral part of the brow. All the extra skin has been removed of the upper eyelid, and you can see how it just softens her appearance. Another example of extreme droopiness of the brow. His brow is so low that the skin of his upper eyelid is basically covering his eyelashes here. You can see them a little bit in the middle. It actually looks like he's hungover or drunk, but he's not. That's just the way he looks. And afterwards, the brow has been lifted, upper eyelid skin has been trimmed. You can actually see the edge of his eyelid once again, a much more refreshed appearance. And here's the lateral view. You can see the extreme hooding of the lower eyelid, and then here we can actually see a little bit of his lower eyelid. Here you can see a little bit of the scar from his eyelid surgery right there. This picture was about a month after surgery. Another picture of a brow lift and upper eyelid surgery. Once again, same thing, skin resting right on the eyelashes. And the brow is actually below the rib of the eye socket here. And then afterwards, the brow has been lifted, the extra eyelid skin has been removed. So the brow is lifted to a natural position, not a deer in the headlights kind of thing, but a natural position. Another one here, once again, upper eyelid surgery and a brow lift. You can see the wrinkles of her forehead. She's actually straining to lift her eyebrows up in this position. If I would have had her relax during this preoperative photo, her brows would be even further down. So that's why she's getting all these deep wrinkles, is from constantly lifting her brow up. So afterwards, now that the brow is in a better position, these wrinkles are much less because she's not straining to hold her brow up. And you can see so much more of her upper eyelid. And it is the same patient. She is wearing blue contact lenses in her after picture. So we're having a special about eyelid surgery. It's 10% off upper eyelids or lower eyelids alone, 15% off if you do all 4 eyelids, and 20% off if you do 4 eyelids plus a brow lift. So you can call our office for a consultation, both the San Antonio office at Olmos Park and the office here in Houston at West University. I do surgery at both locations. You can come in if you have any other questions or would like a consultation, just give us a call. And I guess now we will take some questions if we have some.
Yes, we have a couple of questions from the audience. I have one here that asks about healing time. So is the healing time the same? Is it 2 weeks if you do upper and lower? And does it add on 2 weeks if you do both, or how does that work?
Pretty much if you do any of the surgeries we talked about, if everything goes according to plan and you heal well, 2 weeks back to full activities for upper eyelids or lower eyelids or all 4, even with or without a brow lift. At 2 weeks, it's a pretty easy surgery to recover from. I mean, working out, running, whatever you want to do, 2 weeks for all the different procedures.
And another question or follow-up question, is there really no pain, or can you talk about the pain that's involved with these procedures?
We give everybody pain medication. Our motto is we would rather you have it and not need it than need it and not have it. But it's just Tylenol number 3 with a little bit of codeine. Most people don't take it at all. The brow lift might be the part that's a little more painful, but the lower eyelids and upper eyelids, most people don't even take the pain medication.
Another question is, where are the sutures hidden for brow lift?
They're right behind the hairline. So we remove skin and scalp just a little bit behind the hairline. So a few little hairs will grow in front of the scar.
Okay. Are there age limits to who you will perform brow lifts on?
It's rare to do a brow lift in a younger patient. You saw the patient that had a brow lift only. She was 35, but she had confided in me that her eyebrows were that way from day one, that she had her dad's eyebrows. So would I have operated on her if she looked exactly like that when she was 22? Sure. But usually for the brow to fall, that's something that happens a little later in life. But no, there'd be no age limits.
Okay. How about, is there a fee for the consultation, and will I be meeting with you or someone on your team?
Phone consultations can be done with our patient coordinators. When you come into the office, you're seeing me, and there is no fee for a consultation.
Okay. Let's see. Does a brow lift only remove skin, or does it involve anything with the muscle?
Brow lift, no, I don't do anything with the muscles on a brow lift, just with the skin and the scalp.
Okay. How about when you get surgery in your 40s, do you typically need to do it again? And another person asked same question, but if they start at the age of 52.
Well, gravity continues to take its toll. Usually, there was one patient that actually had a revision eyelid surgery. So I would say that your eyelid surgery is going to last about 15 years, give or take. And if things get loose again, then you might need a revision.
Okay. If you've had Sculptra recently in that area, will they have to wait to get a bleph done?
If it's a lower lid blepharoplasty and you had Sculptra in the tear trough, those are two different areas. You can have your surgery pretty much right away.
We've had a couple of people ask if the sale and procedures are available in other Westlake locations.
These are unique to me only. Our other plastic surgeons perform blepharoplasty, and their prices might be a little different than mine, especially with the special, but you're certainly welcome to go into the other locations and see our other providers.
Yeah, let's see. Could you do video consultations?
We can do telemedicine, or we can do Zoom, or we can even exchange photographs. For eyelid surgery and brow surgery, it's pretty easy just to tell what someone needs just from a photograph, straight on. We're flexible.
Okay. I do have, Dr. Streitmann, a couple of pricing questions, but usually you do want to go over that with each particular patient, as that will.
Pricing can be different for different people. It depends on the degree of the laxity. In some cases, it depends on whether or not it's revision surgery or not. But everyone gets a cosmetic fee quote before they leave that lists out everything itemized: anesthesia fees, facility fees, surgical fees, down to the penny.
Is a brow lift like Botox, but more?
A brow lift is a lot better than Botox. If you do your 11s, those three little muscles are partially paralyzed and your brow might float up in a subtle way. A brow lift is a real lift.
Okay, and then do you perform the procedure in office or is there a different facility?
Our office operating room is a certified OR for both general anesthesia, sedation, and local anesthesia. So we do it on site in our buildings.
What about fat grafting? Can that be included?
Fat grafting to the lower eyelid, I am not a fan. Some people are, I'm not. I recently saw a patient that had some fat grafting to the lower eyelid and ended up with hard little bulges under the skin because the fat partially died, which does happen. So I'm not a big fan of fat grafting. I like doing fillers. Sculpture's great, but I'm not a fan. Other people might be a fan though.
Okay, and I think we have one last question. As far as recovery, when can I continue with my eye makeup?
If it's lower eyelid, you could start right away because there's no external scar. I would say for upper eyelids, the sutures start to dissolve around day 7. So there'd be nothing to keep you from even putting on makeup over the small little sutures if you wanted to. I think it would be safe to put makeup back on in 4 or 5 days.
Okay, thank you, Dr. Streitmann.
Well, thanks everyone for watching. Sure appreciate you taking out time from your lunch to do a little lunch and learn. And if we can help you in any way, please give us a call, or you can set up a consultation through the website at westlakedermatology.com. Thanks.